see my screen at the moment. Brilliant. Just so everyone's aware, we are recording this session today, which we'll be sharing with stakeholders after the show and tell. So thanks everyone for joining. This is our third show and tell. I think our last one was early December, and quite a lot has happened since that time. So today, what we'll be focusing on is how we've adapted to some of the new restrictions, and we'll also be talking about how we're developing the Here to Help tool to get the contact tracing service live and using it day to day. And before we begin, just a quick starter that show and tells are one of our regular methods we use to keep everyone updated on project progress and get feedback from as wide a range of people as possible. So please feel free to put your comments in the comment section or ask any questions at the end. We really value your input at this stage. In terms of our team that are working on this project, our core team includes colleagues from multiple services with a wide range of expertise. So we have colleagues from adult social care, public health, customer services, IT, and as well as colleagues from Maytech external agency as well. And today, as I mentioned, what we'll be covering is quickly some of our project vision and context, how the Here to Help tool supported work to respond to Tier 4, and the work we've been doing in the last sprint as well to build the tool for contact tracing. So in terms of our project vision, we want to develop the Here to Help tool as a single database and user interface to support 4 key strands of the Council's coronavirus response. And this tool should enable call handlers to have the best possible conversations with residents affected by coronavirus and to make it easy to link those residents with the support they need in the community. And those 4 strands are local contact tracing, welfare calls to residents who need to self-isolate, inbound coronavirus helpline calls, as well as calls to clinically extremely vulnerable residents. So just on that final call type around calls to clinically extremely vulnerable residents, a lot of work took place towards the end of December to support residents who were shielding. And that's because on 20th of December, shielding was reintroduced in London, announcement which I think we were all pretty surprised about. And one of the features of this project is that we have to adapt quite quickly to rapidly changing circumstances, either due to the pandemic or because of new government guidance as a result of the pandemic. So with shielding being reintroduced, with colleagues across the council, we responded by proactively contacting shielders in 3 ways. So everyone on the clinically extremely vulnerable list in Hackney, which there were 7,000 people, was sent a text and a letter using the Gov Notify service. The helpline then made proactive calls to everyone who was newly added to that list since the last time that shielding was introduced in November. And these calls involved calling these residents, helping them to understand the new guidance, reassuring them that there is support in place, and connecting those who needed it with crucial support in the community. Finally, there's also a national shielding system. And from that national shielding system, we take daily downloads of all residents in Hackney who have requested help via this portal. And then we present that information in a callback list for call handlers to make those outbound calls. So that process of getting daily downloads of CEV residents who needed a call and presenting that in a callback list was all work that we had prioritized in November. So that made reactivating that work when we needed to in December much easier, and it meant that we were able to deliver valuable services to residents more quickly. In total, we sent over 7,000 texts, over 900 letters to CEV residents. In the first week of Tier 4, the helpline made 161 calls to CEV residents using the Here to Help tool. And since those restrictions were announced on the 20th of December, 61 emergency food parcels were sent to residents with no other access to food. So that's some of the high level information that we've got about supporting CEV residents at the moment. And if Anna Livia's on the line, I'm just going to hand over to her to talk a bit more around how those calls work in practice.
Hello, everyone. So I work on the COVID line, and along with 3 other colleagues, have been making these outbound calls to the critically vulnerable tenants. So before Christmas, as Chris was saying, we received a list of hundreds more of these new calls and to make out. And I would say I made at least 200 to 300 calls, and we're continuing making these calls. Not all of them are answered, but for those that were, I would say 95% of them needed access to food and befriending support. About 40% would need wider needs support, and some needing urgent welfare checks. Almost all were experiencing some degree of loneliness or depression. So currently I'm working on a list of about 18 CEV tenants from Blind Aid who have been referred over as being profoundly lonely and with depression and will need sort of extra wider need support. But everyone's needs will differ. We make 3 attempts to call the CEV tenants. We spread these over a period of about 2 days, 2, sometimes 3 days. If they've both landline and mobile, that will mean that we'll call them 6 times before we close. And we close in the knowledge that they've all been, they've all have received text messages and letters. So the CEV tenants are not just limited to the old and the frail. One of the most sort of profoundly moving cases that I came across recently was I made this outbound call to this girl who was 30 years of age, and in the first lockdown she had had a fabulous life. She was engaged to be married. She had a fabulous job. She was a Hackney volunteer, delivering food to everybody, and just had a really lovely life, and had a pain in her back, went to the doctor and got diagnosed with stage 4 cancer. So it was a really, really sad, really, really moving, because she herself was so spirited, she was so bonny, and there was so much life in her voice. So it was a really difficult call to actually end. But in terms of needs, she didn't actually need anything from us. She had a loving family that were really supporting her. But nevertheless, she was really heartened by the call. We just spent about 3/4 of an hour just talking about the meaning of life. And it was really, it felt really, really meaningful. And it felt like, all these calls that we're making, they sort of differ to the ones that come in. I mean, CEV tenants will call in as well, and along with all other kind of help requests. But making these outbound calls feels a little bit more special because we're making the effort to call them. So it's just a really, really nice thing to do, and I think it really sort of brings Hackney at the centre of the community, which is really good. So because of the call volumes that we get, the amount of call that we have to make out, in the last lockdown, we basically had to record. We had to physically record all this information, the amount of attempts that we've made, which we've made 3 attempts. We'd have to write the details down, with our name, who called. Now with the improvement to the tool, all this is recorded for us. So we make this call, it records our name, it records the time. And then when we look at the profile of the person, we can see that we have made 2 calls, 1 call, 3 calls, which really, really makes a difference to us. It speeds up the process considerably, and it's less tedious. When you're making hundreds of calls, it can get really repetitive if people aren't answering the phone. So Yeah, so it's brilliant, and the I Need Help too. Personally, I've been asked to help out on it loads of times, just to for my opinion, which is really kind of gratifying when you see your suggestions coming to fruition. So yeah, thanks.
Thank you so much, Olivia, for talking us through that on this call. And thank you so much for giving that amazing example of that call you had with the local resident as well. It really shows the value of the service, I think. I'm just going to move back to the slide deck now, and going on to the next section, we'll be talking about the work that we've done over the last sprint, so building the tool for contact tracing. But before we get to the point where we'll be talking about what we've done, Janelle is going to talk through some of the work she does as a contact tracing manager and her needs from the tool that we're developing.
Sorry, good afternoon all. My name's Janelle Sandiford. I've been working on the service since the start, which is in September. We currently have 7 managers and 10 officers on the service, and we work throughout the week, including the weekends. It's been a collaboration between customer service and public health to support Hackney's communities. Next slide, thank you. Just going to talk through the daily tasks for a contact tracing manager. So we will go in Power BI to download the contact list each day. We clean up the data, so we get the data downloaded, we clean up the data and look for any duplications of cases that we've already received. We'll then upload onto the daily call sheet to Google Sheets. That includes various number of sheets and can be quite time consuming. We then text residents alerting them that they'll be called, and in that text it will just give their number so they know it's Hackney that's calling them. We will then allocate the cases to the staff that are working on the day. Again, that sometimes can be time consuming if we've got a high number of cases. And then at the end of each day, which is takes up the most of our time, we would update the call sheets. We will send notification texts to all the cases that we were successfully able to complete tracing with. We will look for anyone that's made any welfare referrals and then allocate those cases onto a new welfare sheet. And then we'll do a summary to the manager that's on the shift the day before. And in total, that can take that process between 30 to 60 minutes. And for everything throughout the day, it can take up to 102 minutes. Thank you, Chris. So what would benefit me and the team from the Here to Help tool is reducing the amount of manual tasks, because I've explained the process in the slide before, but actually there is quite a number of applications that we have open. And so reducing those number of applications would help us as well. And easy allocation of the process. Sometimes we may have 80 cases and 5 maybe of the same household. So it's just being able to easily identify that to be able to allocate it to the same call handler. And then a clear view of the case status and number of attempts made to each case, because at the moment it's all manual. So it's flicking between a number of Google Sheets. And if we had that in a clear snapshot, that would really help. Thank you.
Brilliant. Thank you so much, Janelle.
And just to run through the testing and iteration. So in December, we sort of looked at some of the existing features and then how we can run some user research and testing sessions, where we received some really invaluable feedback for some improvements, which we've been building into the prototype. So currently we have the version 2 of the prototype, which has led to a more visually accessible tool for the call handlers, and it's also easier for the managers to assign calls at the start of the shift, and also log support requests and also retrieve relevant case notes from each of the resident profiles. And then Chris, if I could just share my screen, I'll just give a run through.
Sure. Thanks, Ben.
So can everyone see my screen? So just to run through some of the key features that we've been working on. So in the Here to Help sort of main page, we've now added this assign calls feature where at the beginning of the day, if the manager goes into Here, they can then select the call handlers who are available for the day and assign them according to which requests. And then once they assign, then that feeds back nicely into the callback list, where they can see they're assigned to name and also the type. And then following that, if I just point your attention to this new tab, so we've added. So in each resident profile, you'll have a support requested and a support received. So in the support received, you have each support type, which you'll be able to sort of view, and then you'll see who's been attending to this resident, and then also the relevant case notes according to the support type. We've also added in a few small features, such as when you're back into this page and you're searching for a resident who may not be in the callback list. If I put in, for example, this one, we can see that this one isn't there. So if we go into add a new resident, the postcode automatically passes on into the resident profile form, which then saves the call handler some time and effort in terms of trying to remember which postcode was entered into there. And then also back on the callback list, the call handlers can easily reassign themselves just by clicking on their name, and then also filter each of the support type, so, the callback list items by support type and then by assigned to. Thank you.
Thanks so much for running through that, Ben. And then just moving on to the next part of the show and tell, talking about them making the data processing more efficient. I think, Elle, are you coming in at this point?
Yes, please. Next slide. Yeah, so to make the data processing more efficient, we have been working with the data and insights team to create an automated script that will upload new calls that need to be made into the system. And so the diagram there is if you imagine Janelle there in blue on the left there, when she downloads her sheet, she should be able to just upload it into Google Drive, and the orange bit, that's what we call a Lambda, will be able to deduplicate those residents and correctly assign them to, and correctly import them into the callback list. And then our call handlers should be able to just look at that callback list and call them easily. Next slide, please. And to kind of power this, this way of managing residents, we've been working on cleaning up the data a little bit, because right now on the left you see that we have this massive table that has both the data and their help request data put together. We have been working on kind of separating those things out, so that if a resident returns to the service for whatever reason, like maybe contact tracing needs to contact them again, or they have like a follow-up request that they've put in, we'll be able to correctly identify that this is a returning resident and match their records together. So whoever is making the call should be able to see the full history of when the resident was contacted and what help was given to them. And this should significantly improve the process of the call handlers, so they could see a full history of how like that case has evolved through time. Thanks.
Great, thanks, Elle. Hi everyone. So there's been a lot, as you've seen, there going on in the last month, and I think, as Chris said, like we are definitely contending with the fact that things are changing quite a lot in terms of the context and different ways that services have to stand up quickly and stand down during the pandemic, as well as trying to build this tool out. Certainly a challenge for the work that Elle's described now is also that the data breach that happened at Hackney this week is absorbing lots of our data and insights colleagues' time. So we need to think about how we can replace that lost resource so that we continue working at pace on this. Our focus is to now get that tested prototype to live so that we can get contact tracing live using the Here to Help tool by the 22nd of January. I think that puts us about 4 days behind our initial time schedule. So I think we're in week 9 of the project, and we hoped we'd get it done by week 8. So the team's done a brilliant job at keeping going broadly on track, despite all of the changes that have been hitting us recently. As you saw from what Janelle was saying, the main thing that we're trying to do with getting contact tracing into Here to Help is save all of that manager time. So if we can take out that 70 minutes a day of Janelle's time and all of the scope for errors that come with using spreadsheets, which I know have been creeping in now that the contact tracing numbers have rocketed after Christmas. That's really our primary focus. The next thing, though, that we want to do, and going back to our project vision, is also make sure that all of this makes the quality of the contact between the staff member and the resident as high quality as possible. So the other key thing that we're looking at this week, which Claudia is leading on, is how do we improve the scripts that the staff see and make them much more. So at the moment, these scripts are very complicated. As you can imagine, we have to ask the exact right questions to get the full contact tracing information that we need. They're crossing lots of documents at the moment. And what Claudia is working on is a really simple form, so that all the logic about if this, then that is all built into a form, rather than the staff having to scroll up and down through documents. And we know that will just be a huge benefit to the staff making these calls, but also to the residents to be able to share with us the information that we need to keep, our communities safe. That's the 2 immediate priorities. The next thing that we're doing and thinking about all the time as we go through this work is, while we've got some really clear use cases at the moment, which are these direct pandemic responses, that there are lots of reusable components here that could be very valuable for other staff who are working on frontline with residents. And what we want to really make sure that we're doing is making this tool available to those other teams as well. And that's not just in the council, that might be in our voluntary sector partners. So what we're doing also this week is starting to understand the user needs of those teams and how we might make some of these features available to them. So Stephen runs us on the call. We're working with Stephen to get some user testing with our partners in advice organisations. So that's organisations like Citizens Advice and others who we commission to deliver lots of financial advice services to residents. How might they be able to use these tools so that they can see the whole range of support services that might be available to residents? So I think in our next show and tell in a couple of weeks' time, we'll be able to share back how we're making these tools reusable for colleagues, as well as having contact tracing live.
Brilliant, thanks Zoe. That brings us to the end of our slide deck. Does anyone have any questions at this stage?
Hello.
Hi, Susan.
Yes, thanks for sharing that. Obviously, I'm going to ask about the data for fine support services. How's that going in terms of the plan of integrating it? Because I'm conscious that the call that Anna Olivia had, I mean, I'm sure it sounds like in that situation, the lady had help around her, but that's a situation where it would have been useful to gently mention that there are bereavement organisations and cancer organisations. Well, maybe not bereavement, she's not actually at that stage yet, but things that could have helped her So I'm just wondering what the plan is for integrating that.
You mean, sorry, do you mean during because obviously I would have all that available to hand, I would have all that information, so I will, have those kind of conversations with the tenant.
Yeah.
But if I was struggling to find anything or needed support in dealing with that, then I would use the snapshot tool to help sort out information about where to refer people, etc. to. But I would have this knowledge myself, hopefully, and then if I needed prompting, then the snapshot tool is there to help me. So that's why it's really vital that the snapshot tool is constantly up to date and fully resourced.
Yeah, and Susan, that's the work that Zoe mentioned at the end as well, that we're doing to update Snapshot and make it available to external partners as well. So that's what we'll hopefully have an update on in our next show and tell too.
Brilliant. Thank you.
One of the key changes, as Anna-Olivia says, about keeping the data in there up to date, is at the moment it shows quite a short list of resources that might be available in the community. And once we do the work that build on all the stuff that Susan and team have been doing to get Directory of Services data working and the API working, that we'll be able to pull all of that into Snapshot. So Anna-Olivia, you and others will be able to see a much longer list of things that we can fit much better to each individual resident.
That will be really helpful, because at the moment, because we were all only started this in March, we've been sort of, gathering making our own little folder of things. So it would be superb to have everything in its proper place. But because of the nature of the calls, they're so organic, we have no idea what's coming next. It's brilliant to have access to this tool, at the tip of your fingertips.
Thank you.
Thanks, Susan. And Anna-Olivia. Does anyone else have other questions at this stage? If not, the whole project team's on Slack, so we are happy to respond to any questions that you have outside of this session, or if you'd like to get in contact with me, then my email is at the start of this slide deck as well. If there aren't any other questions at this stage, just like to thank everyone so much for coming. Hope to see you at our next one as well.
Brilliant. Thank you. Bye, everyone.
Thanks, everyone.
Thank you. Bye.
Thank you.
Thanks, Chris.
Cheers.
Chris,